An attachment disorder is a behavioral disorder that affects the ability to form and maintain relationships. Attachment disorders are common in children but can occur in adults. These disorders typically develop in childhood. They can result when a child is unable to have a consistent emotional connection with a parent. There is no formal attachment disorder diagnosis for adults, but they can experience attachment issues. These can stem from untreated or undiagnosed attachment disorders in childhood. The way that a person learns to form and maintain relationships primarily stems from their initial reactions with a parent or primary caregiver during childhood. Experts suggest that genetics may also play an indirect role. However, attachment disorders are distinct, diagnosable conditions. The Diagnostic and Statistical Manual of Mental Disorders lists two types of attachment disorders: reactive attachment disorder and disinhibited social engagement disorder. While reactive attachment disorder often occurs as a result of early childhood mistreatment or neglect, disinhibited social engagement disorder often occurs following neglect in the first 2 years of life. Reactive attachment disorder typically stems from early childhood mistreatment or neglect. If the child does not receive effective treatment, the symptoms of reactive attachment disorder may manifest or continue into adulthood. Disinhibited social engagement disorder may develop in response to social neglect and a lack of consistent attachment to a primary caregiver during the first 2 years of life. Children in social care often demonstrate symptoms of disinhibited social engagement disorder. If a child with disinhibited social engagement disorder does not receive effective treatment, the issue can manifest or continue into adulthood. An adolescent or adult with disinhibited social engagement disorder may display hyperactivity, an extreme trust of people that they do not know well, a lack of awareness of social boundaries, a tendency to ask intrusive questions to people that they have just met. A person with dissociative identity disorder is unaware of their altered personalities. The primary personality only realizes that they have lost time during which the alters were present. There is also a loss of sense of self in the moment for the primary personality. Other signs and symptoms others may notice or the person may experience include uncertainty about their true identity, a feeling of disconnectedness from themselves and the world around them, memory loss related to personal information or everyday events, reduced ability to feel physical pain. An attachment disorder that develops in childhood may affect relationships in adulthood. A person with an attachment disorder may have difficulty trusting others or feeling safe and secure in a relationship. As a result, they may have difficulty forming and maintaining friendships and romantic relationships. The treatment for a childhood attachment disorder typically involves psychotherapy, which may also benefit an adult who is experiencing a manifestation of the disorder. An adult may find therapy or couples counseling useful. Attachment therapy focuses on helping a person overcome the impact of negative early experiences with attachment. It can also help create new, healthier attachment bonds. Couples counseling can help people see how an attachment disorder may be affecting their relationship. With this knowledge and with the therapist's help, couples can develop tools and strategies to strengthen their bond. Untreated attachment disorders in childhood can cause a person to have low self-esteem, difficulty in social situations, and trouble maintaining relationships. They may also experience mental health conditions like anxiety and depression. Cognitive behavioral therapy can help a person change their thought patterns, behaviors, and actions. A child who has experienced any form of neglect or maltreatment likely needs psychological support, regardless of whether they have an attachment disorder. Anyone who feels that their thoughts or behaviors are negatively impacting their relationships should consider consulting a doctor or psychotherapist. Also, any adult who has ever experienced maltreatment may benefit from discussing it with a therapist. Unsolved issues from the past may negatively impact life, emotions, and relationships. An adult is unlikely to receive a diagnosis of an attachment disorder because the clinical guidelines only recognize these issues in children. Nonetheless, if a child with an attachment disorder doesn't receive effective treatment, the symptoms can manifest or continue into adulthood, causing difficulties with social interactions and relationships. If you enjoyed this video, subscribe, like, share, and comment.